Good morning. This is Dr. S. Prince Samuel, working as Assistant Professor in the Department of Biomedical Engineering at SNS College of Technology, Coimbatore. SNS College of Technology is the first Indian institution to implement the design thinking framework in the entire curriculum. The topic which I am going to discuss is about jurisdictional issues in the telehealth platform. It comes under the subject telehealth technology. Before going to the specified topic, let us know the fundamentals of the telehealth technology. The telehealth technology is nothing but the technology which helps both the patients as well as the doctors to treat from a remote place, even from one country to another country. So there are a lot of advantages in this telehealth platform because the treatment gets quicker in some kind of specific diseases where a collaborative research team work together and they help the patient to get rid out of the disease. But there are some the limitations in this telehealth platform because we are dealing with three major concepts. One is the geographic, the state level, and the third one is the international boundaries. So here there are some kind of laws need to be checked before transfer of the medical data from one country to another country. For example, when we speak about the USA, it is one of the most developed countries in the medical platform because they have some advanced kinds of research where when we speak about the MRI scans, KT scans, etc. Some kind of advanced machines are available in the USA. So, what all the medicines, the research practices which are invented by India cannot be easily transferred to another country, for example USA. At the same time, all the medications implemented in USA cannot be transferred to India easily. There are some laws that need to be checked before the transfer of data. This covers all the things because some kind of medications, it involves continuous research. For example, they may treat from 2 to 3 patients based on this improvement or the health condition. Then the research will take place at the further stage to make it as a tablet or a liquid or some kind of injections. So those data has to be confidentially monitored, secured and stored. If any kind of research medical data is transferred, particularly from of a patient to any medical pharmacy company or some kind of any biomedical instruments company, they take the advantage in processing these kind of research data. The business get collapsed, the country economy gets spoiled. So there are a lot of issues, particularly when we speak about the telehealth technology in the international boundaries. One side. On the other side, the treatment of the patient, if we get the proper application from both the governments, for example, the India and the USA, then the treatment can be done through telehealth platform. But at the same time, what about the reimbursement, the insurance coverage? Those kind of things has to be taken in this telehealth platform because most of the countries, except in the Western countries, they make the insurance as a mandatory for every people. Every common people has to have the medical insurance. But in the case of India, it is not a mandatory situation that all citizens must have a medical insurance. So it will deal with three things. One is the Medicare and Medicaid, second one is the private insurance, and the third one is the cross-border payments. This is one of the most important things. What we speak about this is cross-border payments because when we treat this patient through this cross-border technique, who will give the insurance, whether the country from an insurance provider from India or the insurance provider from the USA country. Those kind of situations has kind of e-loss in medicine. These e-loss have to be checked thoroughly. What kind of disease is being treated, what kind of medication is to be done, what kind of treatment is given, how much percentage of treatment is from the India and how much treatment is from the India, whose involvement is more. All these factors has to be checked periodically before sanctioning the insurance. Because each country has got some local privacy laws, cross-border data transfers and cyber security bridges. The law may differ from one country to another country. When you speak about a simple race, for example, the Dolo 650, which is commonly used for a fever, treating the patients with fever, this same Dolo 50 cannot be used in USA as very easily because they have some kind of medicines for treating the patients with the fever. So on another point, the main important thing why these laws are implemented is nothing but the data security. For example, we may give treatment to terrorists or some soldiers, etc., those kind of data has to be confidentially stored, because each country have their border soldiers at their borders. So treating them is the most important task, and the data has to be secured very carefully. So these kind of judicial laws are implemented in the Telehealth platform with a common collaboration between both the governments to treat the patients easily, safely, and the data has to be stored securely. Thank you.